Hi, Julius.
Hi, Rosabel. How are you?
Well, thank you for participating in this little
No.
project. Yeah.
It's my pleasure. Number one and number two. I was trying to call you earlier a couple of times, but your phone goes straight to like voicemail, but your voicemail is full.
Hard to keep up. I got to clear off the voicemails first of all.
Yeah. How are you doing?
Oh, good, good. How about yourself?
I'm doing okay. Thank you so much. Doing
Yeah.
well.
Your daughter.
Yes, my daughter is fine. You know, I'm doing okay. And you know, I have a question though.
Yes.
Really quick. Remember, I don't know if I mentioned this to you, but we have a family member, a 39-year-old lady who recently was diagnosed with seizure disorder, and about a week ago, a little over a week ago, she ended up having a seizure in her sleep. And I don't know if it had anything to do with the way she was positioned in bed, but it may have cut off her windpipe and breathing. And so it just went from bad to worse. I believe she ended up having a heart attack, and she ended up passing away. 39 years old.
Oh my gosh.
Yeah. Two little kids.
And this all happened immediately? She passed away while still in bed at home or on the way to the hospital?
Well, so that's unclear. They did CPR on her for many minutes, close to a half hour. At the house, and probably brought some sort of a pulse back. I don't know, enough for her to be transported to the hospital, but she never regained consciousness, and her you know, her brain began to swell afterwards, and
yeah,
that was it. I mean, then they had to pull the plug on her because there was no brain activity. So my question is, as a result of a seizure, can they experience symptoms where they lose, I mean, where they can have a heart attack? Number one. And number two, going back even, they said that she was going to a chiropractor, and after that her seizure started. So they are tying it to her visits to the chiropractor. Does that sound plausible?
Well, I mean, there are two questions in one. I just first to address the immediate event, you know, the precipitating event and the I guess the terminal event.
Yeah.
There is a condition or an incident, death in epilepsy known as SUDEP, SUDEP, sudden unexplained death in epilepsy. And these cases were of people who suddenly were found dead in the middle of the night or in the morning, apparently having passed away during the night. People who had epilepsy and with evidence of tongue biting or something that indicated that a seizure had occurred during the night.
Mm-hmm. So what's the difference between, sorry to interrupt, between epilepsy and a seizure disorder?
Well, epilepsy refers to somebody having seizures that is likely, has a medical condition that is likely to produce future seizures and therefore needs treatment because they have epilepsy. And if not treated, they will have a risk of injury from further seizures.
Okay.
A seizure disorder is basically when one doesn't know if the seizures are going to occur again in the future. Mm-hmm. If the seizures are caused by a drug withdrawal, for example, of a one-time issue, or a hypoxic event, in a heart attack, and it's not really brain injury or something that will cause future seizures, then sometimes we use the term just seizure disorder.
So epilepsy basically is a recurrent pattern of seizures. Having seizures, that's epilepsy?
Right. It refers to, it means there's something abnormal about the brain that it
I
will
see.
make more seizures. Now,
I
it could
see.
be hypoxia, because hypoxia can cause scar tissue, particularly in the temporal lobes and hippocampus.
Okay.
And that scar tissue can produce epilepsy.
Yeah, yeah.
And so it's not a physical brain injury or a tumor or an infection in the brain. It's just hypoxia, but it causes hypoxic brain injury with scar tissue.
Oh, okay, okay, okay.
And with sudden unexplained death, people usually already have epilepsy. And they're on medications, they might be totally compliant. And most of the cases that were researched in the 90s, mostly the researches were due to respiratory events, either apnea from positioning or loss of oxygen for whatever reason.
Yes.
The apnea then leads to hypoxia to the brain. And in a brain that already has scar tissue and a propensity to cause more seizures, a little bit of a drop in oxygen
that
can
makes sense. Yeah,
be a really bad seizure.
Compromise and really bad.
Right.
But why is it called unexplained then?
Well, it was unexplained when it was unexplained in the early 80s. And now that they did the research, they've classified it into hypoxic terminal, hypoxic death in epilepsy, or central apnea in epilepsy. Yeah. Or it could be drug withdrawal, medication, therapeutic drug withdrawal in epilepsy.
Yeah. The way her presentation was that they were both sleeping in bed, but their backs were towards each other, and the husband's hand was on the wife, and she started shaking, and so he just left his hand up there, hoping that the seizure would pass, and then I don't know what happened after that. Maybe he just dozed off. Later on when he woke up, she was all blue.
Oh gosh! Oh, what a shock for the poor man.
Yes, and so he, I think, called 911, and they sort of walked him through doing CPR, and then they showed up, and it was just not.
What a major tragedy.
She never woke up. Yeah.
I doubt that his hand being on her body, on her chest, caused any problem. I think it has a lot to do. Some of the respiratory events were due to having eaten too close to bedtime and having some regurgitation and choking on food. Yeah. So let's say she had a snack and aspirated and died, especially if she was already cyanotic.
She definitely was. I mean, that's pretty significant. It happened so fast that she was cyanotic already.
I don't know how much time had left. An obstruction of some sort.
Okay.
Yeah.
Okay.
Wow, that's a sad story. 39 years old.
It's really sad.
But the husband should definitely not blame himself. I doubt
he definitely might not be blaming himself, but the girl's parents are.
Oh no.
Yeah. So it's a whole other level now.
No, if you look at the literature on SUDEP, the sudden unexplained death in epilepsy, most of them are non-preventable events, which is scary, because it's non-preventable and non-predictable, except explained after the fact at autopsy.
Sure.
And the majority are respiratory, either aspiration, either hypoxia, medications not taken on time, or a slight withdrawal because of a drug interaction. And it's non-preventable, non-predictable.
Yes. Well, thank you so much for that. So yeah, it seems like I keep bringing you more of these.
Well, it's a common problem. I mean,
but I keep bringing you experiential cases, from myself, my daughter, and now this one. Yeah. Absolutely. All right.